You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Sean Wilkie, and along with my awesome co host, we interview the innovators in this industry every week. Ivan, please get us started.
Hey, I'm Zach. I'm excited about our guest today. We have Dr. Anna Foster. She is a veterinarian and a chief of staff to the CEO of Veterinary Emergency Group. She has been with VEG for 4 years and is passionate about delivering exceptional customer service. Anna loves sharing her top tips on how companies across various industries can boost customer satisfaction and loyalty. She has collaborated with a number of startups in the veterinary space and currently leads both customer and employee experience at VEG. For Anna, being a veterinarian is rewarding because she can help people enjoy longer, happier lives with their pets. Her favorite aspect of VEG is how the company prioritizes keeping people and their pets together. Anna, welcome to the show. Thank you for finding the time.
Thank you for having me.
So I know about Veg. I know David personally a little bit. I was trying to sell him SmartFlow for years when he was in his first hospital. So I still have a little bit of a resentment deep down there, but I transferred that resentment to IDEX. They can be now fighting for that. But no, I love everything you guys do. It's very exciting, but I never actually found out or heard exactly what you do. I know that there's a certain brand loyalty amongst the employees, which is very interesting. And I know that David is very big on culture. But how does that transpire to the mix of customer and employee loyalty? And how does your role kind of intersect in it? And I know I'm asking a lot of questions, but in it, I just want to find out, what does it mean, the chief of staff to the CEO? Like, I'm not familiar with that role.
Great. Okay, maybe we can work backwards. I'll start by answering what is chief of staff to the CEO. That's my role. I've been in this role for about 3 years. I've been with VEG for close to 5 years now, so a little over 4 years. And a chief of staff, it's really, I like to call myself to new people who join VEG, I'm air traffic controller. So people can come to me if they need to know, where does this thing live? What does this function do? Who is this person? I can help them answer that question. But truly, my role is dedicated to supporting the office of the CEO. So that's David Bessler. And my role, his role, VEG as a company has changed over the last few years. I'd say it's almost a different role every 6 months because of the rate that we're growing. And so we have almost 90 hospitals right now across the country, which is really exciting. And I spend a lot of my time, one, helping David figure out priorities for team CEO. And so it's myself, it's David, it's our executive assistant, and then it's the team that we work with at our headquarters. So we figure out what are the priorities that we need to be focused on. And so we have that strategy going. And then separately, there's a handful of initiatives that David specifically cares deeply about. And I'll refer to that as our product, which is experience. And so that's the experience that our veggies have. That's what we call our employees. We call them veggies. So it's the experience that they're having in our hospitals. It's the experience that customers are having in our hospitals and the experience that pets are having in the hospitals. So that is the main focus. Of course, clinical is intertwined in there. That's the root of everything that we do. But I'm spending a lot of my time on those initiatives. So he is the visionary, and then I'm putting a lot of those things into action and coordinating with the different teams to make things happen across the company.
So, from my veterinary integration solution a couple of years that I worked with a lot of groups, my favorite question was to them, especially to those that always talked about the employee experience, how we're changing the industry, saving the industry. My best question was always to them, how do you measure that? So, do you guys have some sort of reliable method of understanding that what you do actually has a positive effect? And is there data that you collect on a regular basis, understanding, is it working or is it not working?
Right. So do you mean the emergency part of things? Do you mean
The customer experience is more or less clear, but employee experience, can you measure that and say we're doing great this quarter on customer experience, or we're not doing so great and this is the metric that tells us about it?
Yeah, that's a great question. And it's something that we spend every week. I'd say every week we have a meeting where we're trying to get better and better at measuring the experience, employee and customer experience. It's not an easy thing to do. it's a lot of the fluffy stuff, right? It's easy to look at a P&L and to track numbers. It's a little more difficult to figure out experience. And so we do look at quite a few different numbers, and we've even made up some measures of our own too that are very specific to what we do at VEG. So, for example, I'll give you a few examples, but there's one, we have something called spikes at VEG that sort of guide our flow in the hospitals. And one of our spikes is that you'll see a doctor right away. Well, how do we know if that's happening in our hospitals, right? How do we know what does right away mean? Is it less than 60 seconds? Is it 5 minutes? Is it 10 minutes? Those are all pretty good for an ER, right? If we're seeing people that quickly. So we came up with a metric, time to doctor, and that's from a customer's perception. So how quickly do they feel that they were seen by a doctor? And that's something that we're able to track in our hospitals. As far as employee experience goes, we do have surveys that we send out. We do quick pulse surveys, and that's one way that we are able to get anonymous feedback from our hospitals and look at overall employee health and engagement in across VEG in certain regions in certain hospitals.
Yeah, that makes a ton of sense and really cool. Measurements, everything, right? What gets measured improves usually is what we learn. So let's step back a little bit and try to understand for the unacquainted what the veg difference is from a customer perspective and then maybe from an employee perspective and who veg is. Maybe people have been living under a rock and have no idea who you guys are and what's different about you. We know that you got 100 hospitals or 90, but let's maybe get you to answer both those three questions. We ask three questions at a time now on this show. It's a new thing that we're trying. Just
Yeah,
you.
you guys are hitting me hard with all these questions. Okay, so let's start with what is VEG. VEG is all we do is emergency. So we're emergency hospitals. It's not specialty, it's not GP, it's just emergency. That's all we do. And so, because we're obsessed with emergency, we're able to really innovate around the entire emergency experience. When I graduated from vet school, emergency wasn't necessarily its own thing. A few people would go into emergency, but it wasn't a thing. It was something that was at specialty hospitals to help service those specialties. And so now we're able to focus on emergency. And then one of the key differentiators when you walk into a veg is that people and their pets are kept together. We're an open concept hospital. So when you walk in, our clinics are kind of built backwards in that you walk in and you're in this giant treatment area and you can see all of the different families with their pets being cared for with all of the veggies who are there. And so right now, the design of our hospitals has continued to change based on the experience that we're looking to provide. And so before we used to have a lobby, you'd go check in the lobby and then you'd go to the back of the treatment area. And we realized that the lobby itself was kind of dead space. People would be up there, but we'd have doctors, nurses going to the front doing exams on these patients. And so more recently, we decided to knock down those walls of the lobby. And now we have a very big open concept area where as soon as you walk in through the vestibule, you're greeted by a doctor and nurse team. And you can see everything that's going on. Of course, we have smaller, quiet areas, nooks that you can sneak away, or exam rooms you can go to if you have a feral cat or an exotic pet that you're bringing in. But everything is together, it's out in the open. So if someone comes in to a veg hospital and their pet needs to be hospitalized, they can stay with them the entire time. We've had people stay for 3, 4, 5 days at a time by their pet's side. They'll kind of pull up a chair, sit by the cage, and they'll wave to all the new customers who are coming in. They'll start greeting them. They'll say, "Hey, this place is great. I've been here for a while." So we'll start to see customers talking to each other, which is really special when that happens, especially if they're going through tough things with their pets. So to be able to comfort each other in those situations and relate to other people is quite nice for them. And if people want to stay the night, we'll make a room for them. We have pull-out beds and they can stay the night with their pet. So that's a big point of the veg difference. And then you might ask, or you did ask, what is that like for the employee experience? And at first glance, if anyone has worked in another vet hospital before and they're just hearing about veg or they're coming into veg for the first time, it might sound a bit scary that the customers are always there, that they're always around. And it's certainly different. And I always encourage everyone, you really have to see it and experience it to fully understand. But yes, you do have customers who are around the whole time. So yesterday I was at our Upper East Side location, and I'm working on something on the computer, and a woman was there with her dog who was having seizures, and she kept coming to like check in and ask questions about her pet because she was worried. And so yeah, I'm doing my notes and helping her at the same time. So it's a different workflow that you're experiencing. However, there's really, really special moments too that happen. And so, me as a doctor, I still practice in our hospitals. When I do surgeries, or say I'm doing a laceration repair and I have the owner sitting right next to me, or maybe scrubbed into surgery and they're kind of watching me get out a foreign body, that is such an impactful moment for them. It is not something that they would see anywhere else except on TV, because people do love watching the vet shows on TV, right? So when you come into a veg, that's happening in real life. But for me as the veterinarian, or for nurses who are working with me, for a pet owner to be able to see how hard we're working and the really cool shit that we do some really cool stuff in vet med. They are just beside themselves. And so for us, it's very fulfilling. There's a lot of burnout in the industry, especially in ER. And if you're not having people recognize the hard work that you're doing or the miracles that you're performing every day, that's pretty discouraging. And so when you have them with you and they're cheering you on and they just think you're the coolest person in the world for being able to save their pet, it's quite rewarding. And you'll ask also when you come into a veg, and maybe you ask employees who've been at veg for a while, what's your favorite part about veg? They will say it's the open concept. It's keeping people and their pets together. So something that is a little bit controversial when you're first hearing about it actually turns out to be the thing that really keeps people at veg, or keeps customers coming back to veg.
That's really cool and definitely different. And but looking at the success of 90 hospitals, definitely looks like has traction. The difficult question about recruiting. So ER is the hardest field to recruit right now. There's so many reasons for it, and we all know them. What is the secret sauce in scalability of finding, hiring, and retaining the talent for the ER? And who is your, if people are listening and wanted to join that experience, what is your key persona description of who is that vet? Is it a new grad? Is it a couple years out? Is it, is it some, like, who is the kind of that best kind of candidate when you're looking at the candidate, you're like, you fit into that framework that succeed the most in our environment?
Yeah, it's a great question. Finding associate doctors and nurses is always challenging, has been challenging the past few years in the industry. So when we're recruiting, we think about, what does the employee want? And employees want growth, right? Most employees want to go somewhere where they can grow and continue learning. They of course want the basics, right? They want a good paycheck. They want the great benefits, but there's more that they want. And so we focus on the growth. We want to be able to have pathways for them to grow, whether that's in their clinical skills or that's a leadership pathway. We have so many different growth pathways for our employees, and they want a place with a good culture. And I don't know that everybody knows what that means. What is a good culture? But they want a place where they can go and do their life's work. A lot of people, if we're talking about veterinarians, they've spent 8+ years in school dedicated to becoming a veterinarian. They want to be able to do their best work possible. And so we focus on that when we're recruiting. And who we're looking for is, it could be a new grad. We call it the nerd program. It's the new ER doctor training program. So we take quite a few doctors. This year, I want to say we're close to 200, if not over 200 new to ER doctors. So that could be a new grad, or it could be a doctor who was in general practice or equine or something else beforehand. And they're coming to veg and we train them. We have a 6-month training program that we put them through. And then if you're switching from another ER, we definitely take ER doctors who are working at other ERs. We take ER doctors or criticalists who've been working in their careers for quite a while, and they can still come to Veg and find growth opportunities with us. And like I said, it could be clinically. We have an advanced ER certificate program that's very, very advanced. And so that's something that we've found to be incredibly engaging for our doctors who've been practicing for a while, that they get to go back to a little bit of the feeling like they're in vet school again, and learning and getting tested and doing some hands-on labs, or if they want to become a medical director and grow from there. So there's different options, but we do focus on how can they grow with us? How can they contribute? How can they be part of a good culture?
Yeah, that makes tons of sense. And it's really fascinating. I mean, sometimes these things that seem so obvious are not obvious, when it comes to innovating, whether it's the whole veterinary experience, which it sounds like you guys have done something truly unique in the industry. And me and Ivan both knew about it. So it's really neat to hear it again. But one of the things that I'm kind of curious about in your position, in the office of the CEO, what are like two or three of the top kind of aha moments that you guys have seen in the last couple of years when it comes to this idea of innovating the customer and employee experience? And is there any crossover? Is there any things that have kind of like, one is you've killed two birds with one stone?
Or I like to say you you feed two birds with one scone.
That's great. We'll work with that.
Yeah, that's a great question. We have had so many epiphanies as we try to navigate customer and employee experience. And I'll say that the biggest one is what we call this virtuous cycle, where happy employees leads to happy customers, and happy customers leads to happy employees. And so we cannot just focus on one or the other. If we only focused on the customer experience, then we're leaving out our employees, and our employees are the ones who deliver the experience. And so that's been an incredible piece that we've realized. And so everything that we do, we're looking at the employee experience and the customer experience. And when we're talking about customer experience too, we're talking about the care of their pet. So that's been an epiphany for us. And then another one that I'll mention is that you do have to design for the experience that you desire. So I mentioned earlier that our just the floor plan of our hospitals has changed quite dramatically over the years. And so it doesn't look like a normal vet clinic when you walk in, where you walk in, you have the lobby, you go to an exam room, and then you have the back. So now we call it the Rover. It's the radically open veg ER, and that is our new floor plan where you walk in and you're part of the action. And so the reason that we have continued to evolve how our hospitals are designed is because it does make it easier to do the things that we promise it will deliver at Veg, right? Whether you're an employee or you're a customer, we make it more natural for you to be able to be with your pet the whole time, or for you to be able to, pets are more comfortable on the floor, right? And so we have a saying at Veg that we sit on the floor. And how can we make that happen if we have a bunch of exam tables that are up high and metal, and you have to lift the pet to put them up there? So we have quite a few couches in all of our veggies in different areas, so that when a pet comes in and the customer, they can have a seat on the couch, and then I'm kneeling down doing my exam with them. So we definitely have to design for the experience. And then I think there have been, I'll just comment on the other opportunities that we've had too, as we've grown from up to 90 hospitals in the past few years, right? It's a little bit easier to manage the experience at a few hospitals, and then you start to get bigger and you have to take a different approach. And so this year we've tried out these sort of campaigns, which is a focus each month on a different part of our experience. For example, one part of our experience is called participation. We encourage veggies to invite pet owners to participate in their pet's care. And maybe that's holding oxygen to a pet's nose when they come in, right? Or it could be helping to hold off if we're going to do a blood draw, but get them to actually participate in their pet's care, because that's memorable. It's something that when people come in and they're so panicked, that you can give them something to do and they feel useful. And so we have a different a different focus each month this year, and that's been one of them. And we've learned that the more that we talk about these things, the more that we'll see them happen. And it's not that we can write these things down like, hey, we wish that the experience would be XYZ and deliver that to employees and just hope that it gets done. It's something that we have to message over and over and over again and find new creative ways to do it. And so whether you're at a practice on your own or you're at a large group practice, you do have to write it down. But then you can't just say it once. It's messaging it over and over and over again, so that people are reminded of that and that they're connected to their meaning.
Amazing.
Yeah, you. I've bumped into that a lot recently because our big thing is employee ownership, and it's interesting that despite the fact that you're giving what people you would think they want, but the messaging and the repeatability and basically being deliberate about it continuously, it's so important to have that in every communication that you have. So that's great. We ran out of time. We always do in this podcast. We could probably have conversation for a couple more hours, but very, very exciting stuff that you do. I really appreciate your time and finding the time to visit us. There are two questions that we ask at the end of every episode. One of them is there YouTube video, podcast, book, or TED Talk, or anything that inspired you recently that you would like to share with the audience?
Yes. So there's two things. I'm going to sneak one in for this first question. And I want to remind everyone of the quote from Maya Angelou about people don't remember what you did or what you said, they remember how you made them feel. And so that's always what we come back to when we're thinking about experience. And so that's just something to kind of ruminate on a little bit when you're thinking about experience. But the book that I'm going to recommend is called Unreasonable Hospitality by Will Guidara. If you haven't read it, highly, highly recommend. So, Will was the general manager of 11 Madison Park, which is a high end restaurant in New York City. It won best restaurant in the world, number one restaurant in the world. And the book goes through sort of this push and pull of hospitality and then the excellence at the restaurant and in the food service. And so when you think of a high end restaurant, normally you'll think of a restaurant that's making these gorgeous dishes and the food quality is so high and they're using these unique ingredients. But really, Will came in and he challenged that and he made it a lot about hospitality. And I think it's so analogous for veterinary medicine because naturally veterinarians will think, oh, well, it's all about the medicine. It's all about the medicine. But arguably it's about the care that we're giving the customers too, the people who are taking care of those pets. And so it's a great analogy. He really challenges us to think outside the box when it comes to customer service, and it's quite an inspiring read.
Amazing. Sounds pretty cool. Last question is another innovator in the industry that you think would be a good guest for the podcast?
For sure. So if we're sticking to this theme of experience, I would recommend, he is a colleague. He was actually in one of the classes above me. His name is Mike Walker. So he's a doctor. He's in Texas in the Austin area. And he started Apollo Vets, which is more of an open concept type general practice. And so he just opened a second location. So he's proving that some of the things that we do at VEG can be applied to general practice and to smaller hospitals. And so I think it'd be really interesting to get his perspective too, because it's not just the veg way. It's something that I think pet owners are starting to desire and that veterinarians are desiring. And so starting to unlock what are some of the commonalities between these newer hospital types that are popping up would be super interesting for listeners.
Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinaryinnovationpodcast.com. See you next week.